Chrissy Zettel, and I'm here with Lourdes today doing a presentation on breast cancer. I'm also finishing my last semester of my bachelor's, so I have to do a community project, and what better than breast cancer, since it's breast cancer awareness. So we have to ask ourselves, what is breast cancer? Well, breast cancer is where you have abnormal cells in your breast, and when they start multiplying, then it becomes a tumor eventually. So you can see this is a normal cell, and then these are abnormal cells, cancer cells, and once they start breaking off and going into the lymph system or the bloodstream, then it metastasizes and goes to other parts of the body. So what causes it? We really don't know what causes breast cancer, that's why we can't stop it. And then women are mainly affected by breast cancer. Men can be, but it's mainly women. So we wonder, is it just contained to the breast? No, because if it gets into your lymph system or your bloodstream, then it can go to your brain, your bone, your lungs, or the liver. And it's called metastasis, or spreading to other organs. So some statistics on breast cancer would be there's 200,000 new cases of breast cancer each year. The growth rate of breast cancer is different depending on what stage the breast cancer is in, so that's really not a short answer. It just depends on what type and how aggressive it is. 1 out of every 8 women will get breast cancer at some time in their life. And then the main risk factor for breast cancer is age. So typically women in their 50s, 50 to 60, have the highest rate of diagnosis of breast cancer. The risk factors for breast cancer is age. If 40 and over, we want you to start getting your mammograms. And then being female in general increases your risk. If you have a family history, such as your mother, your aunt, your grandmother, then that will also increase your risk for breast cancer. Use of estrogen, such as birth control pills or hormone replacement therapy, will increase your risk. Obesity.
Good to know.
Yeah.
I swear up and down here.
What's that? Family history.
No.
Oh, birth control.
Oh, they're fine.
Well, they don't really want you to take them after you're 35.
Yeah.
It increases your risk after age 35. And then the BRCA gene, everybody has BRCA genes, but once you get a mutation in that gene, that's what is concerning. That test costs about $4,000 out of pocket. So, but then the rest of your family, they can all get tested for $300. So if you have a mutation in those genes, then you're more than likely will get breast cancer. Your menstrual period, if you start before age 12, or if you have you start late menopause, that can increase your risk. And then, of course, with everything else, alcohol and smoking are risk factors. If you have not had any children, or if you've had your first child after the age of 30, your risk is increased. If you have 2 or more close relatives, such as your aunt, your grandmother, your sister, with breast or ovarian cancer, then that can cause a higher risk. Some of these we can change, such as obesity, and if we drink or smoke, but we can't change our family history. Those are just what God gave us. So what do we need to do starting at age 20? We need to start doing our self-breast exams at home. We need to do a clinical breast exam when you go get your pap smear and your physical for the year. Your doctor or nurse practitioner will do a breast exam. And then at 35 years old, you should start getting a baseline mammogram. Yeah. And you still want to be doing your self-breast exams, and then your clinical breast exams at least 1 to 3 years you need to be going to have those. By the age of 40, you should get a mammogram every year. And then continue to do the clinical breast exam and self-breast exam at home. That's just a little funny picture. Oh, yes, I did have my mammogram today. She's got her breast all flattened down. Why do you ask? So when we should call the doctor is if you can use this little model here and feel around on it to see if you can feel those lumps in there, and you want to use the pads of your fingers to go around. And usually when you're in the shower, about 2 weeks after your period, so that you're not quite painful and lumpy and bumpy. Yes, there's about 3 in that one. So if you have firm breast tissue or just a change in the texture of your breast or under your arm, then you want to call your doctor. And if you have any discharge other than milk coming out, then you want to call. And also if you have a retraction in your nipple or pulling in of it, then that's a concern. Also any itching or burning or flaky skin, we want to call. And if just the size of your breast changes or any shape or anything, you want to give them a call. And you can see in the pictures here that's kind of a retraction, and then the changes in the texture. Usually I've seen some that looks like an orange peel, so, and that was actually a later stage. And then any kind of fullness that hasn't been there. So when you go to the doctor, what you can expect is to have a clinical breast exam, because they're going to want to see if there's flakiness or what you're seeing. And then they're probably going to order another mammogram if you haven't already had one. If you have any calcifications or any masses or anything that they see on that mammogram, they'll probably go ahead and take additional views that day. So the radiologist will read it then if you're having problems when you come in and tell you then, yes, we see something. If you come in just for a screening, then it'll be the next day. Lewis calls you the next day and lets you know what your results are, so you don't have to sit and wait. So also, they may want to do an ultrasound. If they see something on the mammogram, then they may want to go ahead and look at it under an ultrasound.
I hope so.
So what if it does show something? You're going to have a biopsy to be able to tell if it's cancerous or not. If it's calcifications, then what they do is you have to have a stereotactic biopsy. And that's where you lay on your stomach and they put your breast through a hole and put it in a mammogram, and then use the biopsy machine, and they take out a core of breast tissue and then send it to the lab to test it. If it's a mass or a lump, then what they do is just use the ultrasound machine and put a needle in if it's a cyst and aspirate it. Or if it's a mass, then they take the mammotome machine and go in and core it out, take the tissue and send it off. And then you'll have a consult with your physician who may refer you to a surgeon, depends on what they found. So if it does come back and it's cancerous, then you'll review your options with the surgeon, get an appointment with them, and the options are anywhere from a lumpectomy to bilateral mastectomy, where they remove both breasts. And you also have to have radiation and chemo sometimes. You have any questions so far? Whether you're going for a screening mammogram or you're going because they saw something, everybody needs support as far as, that's the scary time whenever you have a possible breast cancer diagnosis. So, your family and your friends, if you go to church, your church family could be a support. Both hospitals in the area have nurse navigators. And what they do is an emotional support, and we have brochures out here you see at the end of the table with the nurse navigator. They do emotional support, financial support, just answering any questions and talking to women about, just their concerns. And then any questions that you have, they always give you their card and phone number so that you can call and ask them questions. So the Kentucky Pink Connection is another. I don't know that we have any cards about that, but what we could do is go online and find out about the Kentucky Pink Connection and what it's another resource and support system for women. What it does is you could call them up and they could find you support groups in the area, because it is a statewide resource. You could call them and they could give you some people don't have transportation to mammograms, and that's one reason they don't get it, or they can't afford a mammogram, so they can help with that. And also they help with like wigs after chemotherapy. It's a really good resource. And then there's always breast cancer supports through the hospitals, sometimes maybe your church, or the Kentucky Pink Association can hook you up with support groups in your area. This is just different societies that can give you more information if you want to know more about breast cancer. Of course, the National Cancer Institute, breastcancer.org is a good one. The FDA, Centers for Medicaid and Medicare Services, all these are good. And of course, the American Cancer Society, all these are good resources to use. Any questions? No? Do you feel like you've gained knowledge about breast cancer?
Well, yeah, now I'm mad about my birth control pills.
I know, I have been too. All right. Well, thank you for coming today. I do have a little survey for you to fill out just to see if you did gain any knowledge and if I answered any questions that you might have.
Well, good job.
Thank you. Anyone yet?
Got it.
All right. Well, I'm Christy Settle. I've been a nurse for about 8.5 years, but I recently went back to get my bachelor's, so I had to do a community project. So what better than breast cancer since it's breast cancer awareness? So a lot of people, what is breast cancer? Well, it's where you have your cells have